Dr. Scott Thompson is joining me now from Utah Facial Plastics, and we are talking about non-surgical and surgical options for neck tightening. I might be wearing a turtleneck today for a reason. No, but it's true. Sometimes you look in the mirror and you say, I feel great, but why is that skin not the same, not as tight as it used to be?
Yeah, and this is tough to talk about after baby chicks and monkey bread.
It's so
not
true.
Too exciting,
it's so true, but it's actually important, and it's actually what so many women, and I think men, see when they look in the mirror.
Yeah, I'd say one of the most common things I hear when people come to the office of all ages, it could be someone in their 20s or 30s, and they say, you know, I've worked out, I've lost weight, but I still have this fat right here that's just driving me crazy. Or the older patient who comes and says, I used to have this amazing jawline, and now there's all this saggy muscle and skin, and it's driving me crazy. So it's a kind of a universal problem.
I think you take care of your face. I mean, a lot of us do. You take care of your body, but your neck often gets left on the wayside.
Yeah, and the neck skin just doesn't have the same elasticity as the rest of the face. It's also susceptible to scarring from laser procedures and things, and so it's a tough area to treat sometimes.
All right, so Dr. Thompson, if someone came in and they were worried about what you said, that fat area right there, what would be a non-surgical option?
So if it's kind of an isolated, moderate area, there's a new treatment, we've talked about it before, called Kybella, which is an injection into the chin, totally non-surgical, and it usually requires a few treatments, but it dissolves fat through a chemical process. And you know, it's been FDA approved for several years now. We've been using it and been really happy with it.
How many treatments to see the results on camera right now?
It would probably, for most people, I would say 5 to 6 treatments to get a significant result, you know, something like that.
Look at that change, though. That skin, it not only removes the fat, but tightens the skin right
there?
there?
Yeah, it kind of tightens the skin because it creates a little bit of a scar underneath the skin, and so it can also create a little bit of tightening.
Is there a surgical option you would recommend if someone wanted to go that route?
Yeah, for example, this patient right here, you can see how much improved the neckline and the jawline is on him. And a big problem with him was his chin, and so we need to actually expand his chin a little bit, augment his chin, in addition to removing some of the fats. And that's more of a surgical procedure, but even that, the downtime is quick. He was back to work almost immediately with minimal bruising, and so, you know, sometimes people get a little bit nervous about surgery, but it's, you know, sometimes we can do things in the office and the recovery is quick and it works great.
What is it about the word facelift that so many people have? You get afraid of it. Like,
well,
am I doing that?
Yeah, I mean, I think it's a procedure that's been around for a long time, and there certainly has been a stigma associated with it in the past. People continue to see well-known people with a lot of money that don't seem to have good results from facelifts, and so, you know, understandably there's some concern and caution in proceeding with some of these things, but there have really been a lot of amazing advances in the field of facial plastic surgery, to the point now where I think we can perform a facelift and a neck lift on somebody and they can really retain their unique identity and their features, and they can look natural, but they can sort of restore what they used to look like 10 or 15 years ago.
And that's the key, is you still look like you.
Yeah, restore.
It's
not a change, it's to restore.
What about the tightening? We talked about that fat removal. Both of these procedures work for the tightening of the skin as well?
Yes, they do to a moderate degree. If it's fairly mild to moderate, that's when I'll tend to recommend the non-surgical treatments. If it really becomes very lax, there are a few options. My partner that just joined me, Dr. Henstrom, who's probably going to be on the GTU one of these times, he does a direct neck excision that's a non-facelift type of thing, and it's a lot of times something that men are looking for that need to get back to work quickly. So there are a lot of surgical options and a lot of non-surgical options. It just depends on how, I guess, advanced the laxity is.
I like that you mentioned men as well as women, because this is a procedure that both are interested in.
Yeah, I can't tell you how often people come in, men come in and they say, I don't care about any of this, but I hate this right here.
Like
what
the
can you
turkey
do about that?
Like that turkey area.
Yeah.
I recommend following Utah Facial Plastics on social media, because they do a lot of these procedures and walk through them. So you can watch and see what happens and you get a sense. The Utah Facial Plastics is on Instagram and also Facebook and online. Go to our website. We will link you to all of their information. Right now, $400 off Kybella. So make sure you go and get all the details right there on your screen. They have a phone number too. Dr. Thompson, it's so good to see you.
It's always a pleasure.
Thanks for
Thank
coming
you,
back
Nicea.
and following up the baby chicks. I know.
Yeah.